Hi everyone. Today in this video let us discuss Tamsulosin versus Finasteride. What are the similarities and differences between these two drugs we will discuss in this video. Tamsulosin is available under the brand name Flomax. It is available as its salt Tamsulosin hydrochloride. On the other hand, Finasteride is available under the brand name Proscar. Both of these drugs, both Tamsulosin hydrochloride and Finasteride, can be used in one of the condition benign prostatic hyperplasia, commonly known as BPH. This condition is observed in the men with age greater than 50 years. With the progression of the age, prostate enlargement can be observed, resulting in benign prostatic hyperplasia that leads to the development of lower urinary tract symptoms. So in such patients, we can observe increased frequency to urinate, increased urinary urgency, but at the same time, urinary flow is going to be reduced, resulting in weak stream of urine. So these symptoms can be reduced by both Tamsulosin as well as Finasteride, but the dosage is somewhat different. Flomax is available as a capsule at two different strengths such as 0.4 mg and 0.8 mg, but the Proscar is available as a tablet at a strength of 5 mg. Even both of these drugs are indicated for the treatment of BPH. There are few similarities and differences between these two drugs. In few of the situations, Tamsulosin is beneficial, but in other conditions, Finasteride works more better. So today in this video, we are going to see what are the various similarities and differences between Tamsulosin and Finasteride, and in which conditions these drugs are preferred, we will discuss in this video. So the first one is the increase in urinary flow. Tamsulosin is one of the alpha-1A blocker. This drug acts on the bladder where alpha-1A receptors are expressed at different locations. On the bladder neck they are expressed, as well as they are also expressed on urethral smooth muscle attached to the prostate. When these alpha-1A receptors are activated, they produce a contraction of the smooth muscle. Particularly at the bladder neck, they produce a contraction resulting in the increased pressure, leading to increased frequency of urination in the patients. Similarly, these alpha-1A receptors are responsible for constriction of urethral pathway, resulting in the decreased urinary flow. Now, Tamsulosin is a alpha-1A blocker. It can block these alpha-1A receptors, resulting in the relaxation of smooth muscle, which reduce the urinary frequency, as well as it can increase the urinary flow. That's why Tamsulosin is well known by its brand name Flomax, because it increases the urinary flow. Now, Finasteride acts in a different way. Finasteride is a 5-alpha reductase inhibitor. This drug is also indicated for BPH, which is associated with prostate enlargement. Now, because of increased prostate size, it can produce some pressure on the bladder so that urinary urgency increases. But at the same time, because of increased prostate size, the urethral flow is also blocked, resulting in decreased urinary flow in such patients. So this results in urinary retention, and sometimes it requires surgery in order to restore the urinary flow. In those patients, Finasteride can be given to reduce urinary retention as well as to prolong the time required for surgical procedure. So Finasteride can act on the prostate gland, thereby can reduce the prostate size, which increases the urinary flow. Now, both Tamsulosin as well as Finasteride can increase the urinary flow, but they work in different way. Tamsulosin produces relaxation of the bladder smooth muscle, whereas Finasteride reduces the prostate size. Even though both of these drugs are going to increase the urinary flow, but the Tamsulosin is having the more effect on increasing the urinary flow compared with Finasteride. That's why Tamsulosin is used as the first-line drug in the initial stage of BPH, because this drug can increase the urinary flow significantly, thereby can reduce lower urinary tract symptoms associated with BPH. Second one is the prostate size and volume. Normally, the prostate size can be measured by one of the factor total prostate volume, commonly known as TPV. In the normal healthy people, the TPV will be less than 25 cc. But in the men with BPH, the total prostate volume may be increased which is associated with few of the symptoms such as increased urinary frequency and urgency along with decreased urinary volume. In such conditions, Tamsulosin can be used to relieve the symptoms where it increases the urinary flow, but with progression of age as well as with progression of BPH, the total prostate volume may be increased so that it is greater than 30 cc. So when the TP value is greater than 30 cc, it indicates a prostate enlargement, but sometimes this total prostate volume may be greater than 40 cc. In such conditions, the monotherapy of Tamsulosin is somewhat ineffective. So when the TPV is greater than 30 to 40 cubic centimeters, then Tamsulosin should be combined with other drugs which reduce the prostate size. For instance, Tamsulosin can be combined with Dutasteride, which is again another 5-alpha reductase inhibitor. But in the patients with prostate enlargement, Finasteride can be given because it reduces the prostate size, and it can be given as a monotherapy in order to reduce the urinary retention. Third one is the type of clinical indication. Already we have seen that Tamsulosin can be used for the treatment of BPH. It is given at an initial dose of 0.4 mg. On the other hand, Finasteride can be used in two conditions and it is available under two brand names. The first one is a Proscar and second one is Propecia. Under the brand name Proscar, Finasteride can be used for the treatment of BPH, where it is available as 5 mg tablet, whereas under the brand name Propecia, Finasteride can be used for the treatment of male pattern hair loss and it is available at a dose of 1 mg. So low dose of Finasteride can be used for the management of male pattern hair loss. This is another difference between the Tamsulosin and Finasteride. Finasteride is having two clinical uses. It can be used for both BPH as well as for the treatment of hair loss, where it is given at a low dose. Fourth one is the time of administration. We have seen that Tamsulosin can be used to relieve the symptoms in the BPH and it is one of the first line drug in the initial treatment of BPH. This drug is given 30 minutes after first meal of each day in order to reduce any adverse effects. It is always given along with the meal. Particularly it is given at the first meal of the day just after 30 minutes. As when this drug is given along with food, it can reduce any adverse effects associated with this drug. But when this drug is given under fasting conditions, the absorption of Tamsulosin is significantly increased, which increases the toxic effects resulting in significant dizziness, hypotension in the patients. That's why this drug should not be given under fasting conditions. It should be given 30 minutes after first meal of each day. On the other hand, Finasteride can be given either with food or without food because food is not having any significant effect on bioavailability of Finasteride. So this is another important difference between the Tamsulosin and Finasteride. The intake of Tamsulosin should be regular and it is associated with the first meal of the each day. Fifth one is the pregnancy. Both of these drugs, Tamsulosin as well as Finasteride, they are indicated only in the men for the treatment of BPH. They are not indicated in the women as well as in the pregnant women, they are contraindicated. But the handling of Finasteride is somewhat important because when this tablet is going to be broken, it is in contact with the pregnant woman, there may be a chance of accidental consumption where the drug is absorbed into the fetus, resulting in some toxic effect to the male fetus. That's why Finasteride should be safely handled with the pregnant woman in order to prevent any toxic effects on the male fetus, as it produces some abnormal development of male genitalia. So Finasteride should be carefully handled by pregnant women. That precaution is not observed with Tamsulosin. Sixth one is the orthostatic hypotension. In the patients with any history of orthostatic hypotension, we can observe a change in the blood pressure with change in the posture. Particularly on standing, the blood pressure is going to be reduced, resulting in either fainting or falling. So in such patients, Tamsulosin can increase the dizziness as well as confusion because Tamsulosin can increase the symptoms of orthostatic hypotension. So in the patients with any history of orthostatic hypotension, Tamsulosin is contraindicated due to enhanced effect of dizziness and confusion in the patients. But Finasteride is not showing any significant orthostatic hypotension that was observed with Tamsulosin. So this drug can be given in such patients with any orthostatic hypotension. Seventh one is the ejaculatory problems. Testosterone is going to be converted into dihydrotestosterone by one of the enzyme 5-alpha reductase enzyme. Now finasteride is going to inhibit the activity of this enzyme, thereby it inhibits the synthesis of dihydrotestosterone. When this activation is inhibited, finasteride can produce few of the hormonal effects and it may produce some impotence in the patients as well as loss of libido, sexual desire can be reduced, even it can produce erectile dysfunction leading to ejaculation failure. All these side effects are observed with the finasteride because of its hormonal effects. On the other hand, Tamsulosin can also show some effect on ejaculation. This drug can produce one of the condition priapism, which is a condition of prolonged erection of penis for greater than 4 hours, resulting in painful erection. So this Tamsulosin can also produce ejaculation failure because of prolonged erection. So both of these drugs may produce some ejaculatory problems. But being a hormonal agent, finasteride produces more effect on these ejaculatory problems that may lead to impotence, loss of libido, and even it can increase the breast tenderness, breast enlargement in the men. Next one is the drug interactions. Tamsulosin is metabolized by cytochrome P450 system. This drug can be converted into metabolites by CYP3A4 enzyme, which is mainly responsible for the metabolism of Tamsulosin. Similarly, this drug can also be converted into metabolites by another enzyme CYP2D6. Now, any drugs acting on these enzymes can produce drug interactions with Tamsulosin. For instance, ketoconazole is one of the strong inhibitor of CYP3A4 enzyme, thereby it inhibits the metabolism of Tamsulosin. This results in increased levels of Tamsulosin within the body that leads to significant lightheadedness, dizziness, confusion, orthostatic hypotension, which are more troublesome. Similarly, drugs like paroxetine can inhibit the CYP2D6 activity, thereby again they increase the toxicity of Tamsulosin. On the other hand, finasteride is free of these side effects. It is having no significant interactions at the metabolic phase, so it can be safely given with other drugs which are affecting cytochrome P450 system. Ninth one is the prostate cancer. Both Tamsulosin as well as finasteride can reduce PSA levels, prostate specific antigen levels. Normally, in the patients with any prostate cancer, the PSA levels are increased, but with use of either Tamsulosin or finasteride, the PSA levels are reduced, which can mask the development of prostate cancer in the patient. That's why before use of these two drugs, a screening test should be done to check any pre-existing prostate cancer in the patient. The use of Tamsulosin for long term can induce the prostate cancer as well as with the finasteride, but the risk of prostate cancer is more pronounced with the finasteride because of anti-androgenic effects. 10th one is the cataract surgery. Tamsulosin is a alpha 1A blocker, so it can act as a smooth muscle relaxant. So it can produce a relaxation of various smooth muscles where alpha 1A receptors are located. One of the location is on the eye. Tamsulosin can produce relaxation of the iris dilator muscle. This may result in the poor pupillary dilatation and flaccid paralysis. That's why Tamsulosin should be carefully given in the cataract surgery because this drug can develop one of the syndrome, intraoperative floppy iris syndrome, IFIS. So during the cataract surgery, care should be taken with use of Tamsulosin and special technique should be utilized in order to prevent any development of intraoperative floppy iris syndrome. Sometimes Tamsulosin can also increase the post-operative intraocular pressure in the patients. So this can be minimized with proper use of cholinergic agents and antihistamines to control the intraocular pressure. On the other hand, finasteride is not showing any effect on cataract, so it can be given during the cataract surgery. So these are the various similarities and difference between Tamsulosin and finasteride. In few of the situations, Tamsulosin shows some advantage. It can significantly increase the urinary flow, thereby it can relieve lower urinary tract symptoms associated with BPH. That's why Tamsulosin is a first-line drug in the treatment of BPH. But this drug does not affect the prostate size and it will not reduce the prostate volume. So in those patients with significant prostate enlargement where total prostate volume is greater than 30 cc or greater than 40 cc, in such situations finasteride works better because it reduces prostate size as well as prostate volume. Tamsulosin is contraindicated in the patients with orthostatic hypotension, and it also shows drug interactions which affect the metabolism of tamsulosin. On the other hand, finasteride can produce impotence in the patients as well as it can induce the erectile dysfunction. It should be carefully handled with the pregnant woman because of teratogenic effects on male fetus. So these are the various similarities and difference between tamsulosin and finasteride. Tamsulosin should be used to relieve the symptoms in the patients associated with BPH. Finasteride should be used in those patients with excessive prostate enlargement. So that's all about the similarities and differences between tamsulosin and finasteride. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.